You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so many perverse incentives, and these are modeled studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services.
Senator Mark Warner came prepared to find common ground with HHS Secretary Robert F. Kennedy Jr. on chronic illness. What he got instead left him stunned. When Kennedy admitted he didn't know how many Americans died from COVID or whether vaccines prevented deaths, 8 months into his tenure, Warner's frustration boiled over. How can you be that ignorant? The clash over rural health care only intensified.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped. I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when we met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was so many perverse incentives, and these are modeled studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
That's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Kraus. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Kraus.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you've got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, me, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple. So maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support.
Do you support? You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare. So you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill because across America,
What about what?
hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
This confrontation between Senator Mark Warner and HHS Secretary Robert F. Kennedy, Jr. encapsulates the frustration many feel when ideological commitments appear to override basic governmental competence. Warner entered the exchange expressing genuine hope for collaboration on chronic illness, only to discover that Kennedy lacked fundamental knowledge about the COVID-19 pandemic and its impact on American lives. Kennedy's admission that he doesn't know how many Americans died from COVID-19, a figure widely reported as approximately 1 million, was stunning coming from the nation's top health official 8 months into his tenure. This wasn't a minor statistical detail, but rather the defining public health crisis of the past decade. His claim that nobody knows due to data chaos may reflect genuine concerns about data quality, but it also conveniently allowed him to avoid acknowledging the scale of the tragedy or the effectiveness of interventions he philosophically opposes. Even more striking was Kennedy's refusal to acknowledge whether vaccines prevented additional deaths. When Warner pressed him on this foundational question, Kennedy repeatedly deflected by saying he'd like to see the data, despite having had 8 months to review it. This response suggested either willful ignorance of existing research showing vaccines prevented hundreds of thousands of deaths or an unwillingness to acknowledge evidence contradicting his long-held positions publicly. Kennedy's counterclaim that the Biden administration politicized all the data and fired all the people who questioned the orthodoxy sought to shift the conversation from his own knowledge gaps to accusations of misconduct by the previous administration. However, this deflection only reinforced Warner's central critique, that Kennedy was more interested in ideological battles than in understanding the actual health data he was responsible for. Warner's exasperation, "How can you be that ignorant?" represented a rare breakdown in senatorial decorum, but it reflected genuine incredulity that someone leading HHS could claim such fundamental ignorance about the pandemic. Warner's reference to Kennedy's earlier unfamiliarity with community health centers during confirmation hearings suggested a pattern of unpreparedness rather than an isolated incident. The exchange on rural hospital closures revealed critical policy disagreements. Warner presented concrete evidence from his own state, a Franklin, Virginia, rural hospital preparing to close, with the hospital system so afraid they wouldn't even let me have the meeting there. This painted a picture of healthcare institutions in crisis and fearful of political retribution. Kennedy's flat denial that there are no cuts to Medicaid directly contradicted Warner's observations and multiple independent analyses. The discussion did find productive ground when Warner raised specific policy solutions. Kennedy's support for the Area Wage Index legislation, which would increase reimbursement rates for rural providers to 80% of urban rates, represented concrete agreement, though this would increase costs to Medicare and Medicaid. Similarly, Kennedy's willingness to work on legislation preventing rural hospitals from closing OB/GYN services showed potential for collaboration. However, Warner's invitation for Kennedy to visit a Virginia community health center highlighted the disconnect between Kennedy's priorities and immediate health care needs. Warner's constituents want access to nutritionists and healthier food, goals Kennedy champions, but they also need basic health care services that Warner fears are being dismantled. The broader implication is troubling for those who hoped Kennedy's focus on chronic disease might transcend partisan divisions. Warner represented that possibility, a Democrat personally affected by family chronic illnesses and genuinely interested in prevention. Yet Kennedy's inability to acknowledge basic COVID-19 facts, combined with policies threatening rural healthcare access, made collaboration impossible. This raises fundamental questions about whether someone who questions foundational epidemiological data can adequately address the full spectrum of healthcare challenges facing Americans.